Okay, so Dr. Lawrence here, and I'm with my patient, Lauren, who was referred to our office by one of our other patients. And initially, when she came in, she was here because of a lower back issue, and she likes to run competitively, and she was concerned that she had an upcoming race, and she wanted to improve on the time that she had. So, Lauren, why don't you say a little bit about your experience and what brought you in?
Well, I was experiencing lower back pain. It was hurting to stand and sit if I was sitting for long periods of time. And I was feeling that same pain when I was running.
Mm-hmm.
And I'm running long distances. I'm training for a half marathon. And so I'm putting a lot of miles in during the week. And just wasn't happy with the way I was feeling and wanted to feel good. And I also wanted to improve my running time and just enjoy that more. So, I came here. I've been hearing about Dr. Lawrence for over a year now from a coworker, and I've heard wonderful things. She's a miracle worker, and it's true. So I came in and felt almost immediate improvement. It's been amazing at the improvements that I've had. My running time, I just ran a race this past week, and I've been trying to, of course, reduce my time because my goal this year was just a place in my age division.
Mm-hmm.
And it was a 5K race, and I've been trying like crazy to beat 28 minutes to even be considered in my age division for third place. And I ran the race and did it in 26 minutes and 19 seconds. And not only was that my personal best, but I won best overall female in the masters division, and I
Wow.
was totally caught off guard. And I know I couldn't have done it without the help that she's given me, not only with my back, but she's helped me with my legs. And apparently I was a knotted up mess from my waist down, and she's untangled
Yes.
those knots. And,
Yes, you were. You know what always amazes me too, and Lauren will speak to this as well, is that so much of the time someone looks relatively athletic and someone like, you were running all the time, but the reality of the situation was you didn't have much range of motion at all. Everything was really short on you, on the front and on the back, and now that we've gotten that loosened up, you have a better stride, and that's a lot of the reason that you have you've gotten that better time. But I couldn't have done it without you. You were here when you were supposed to be, and you've been following your instructions at home too, so I always appreciate that. Anything else? Well, let's look at it this way. What would you say to someone who is a runner, competitive in some nature like that? Would you recommend this type of care to them?
Oh, I already have. I've got some friends that are runners, and I've tried to lead them your way because we all have aches and pains. That's a normal
Sure.
and natural part of the sport.
Mm-hmm.
But when it makes a difference and you actually can get past the pain and feel good doing it, it makes all the difference in the world. And we abuse our bodies, but then you put us back together, and it makes it all worth it.
My pleasure. Thanks, Lauren.
Thank you.